Hello and welcome to On the Beat. I'm Linda Colson, and today we're going to be speaking with two doctors from Gastroenterology Associates in Columbus and Starkville. And first we'll be speaking with Dr. William Gillespie and of course Ricky Johnston as well. And we have subject matter today that I think is very personal and yet it's something that many of us deal with, and that's hemorrhoids. Tell us just a little bit. Whomever would like to address this, okay? What are hemorrhoids exactly?
So hemorrhoids, contrary to what a lot of people think, everybody has hemorrhoids. They're part of our anatomy. I mean, we're built with them. They're basically little veins that occur in the lower part of the rectum around just above where the anus is. And in some people, they can get swollen up and can lead to a variety of symptoms. But really, everybody has them. But in short, they're just basically little veins that occur in the rectum.
What would cause that?
We see it most commonly women who've been through pregnancy. So things that increase your abdominal pressure, like straining with bowel movements. We see people who lift weights, but pregnancy is a big one too. So a lot of women, when we talk to them about their hemorrhoids, will relate onset of their hemorrhoid symptoms to their first child.
So strain and stress can just
right, and so
wreak
constipation,
havoc.
yeah, exactly.
Well, tell us how that's treated. Can you tell us, Dr. Gillespie?
Well, generally, we kind of figure out why you're having them. If it's constipation, you're doing a lot of straining, then we treat your constipation, and a lot of times that's enough to kind of calm the hemorrhoids down, and we don't have to do too much else. Sometimes we'll give steroid creams or something if they're really bad. And then ultimately, if we treat all of the underlying causes and you're still having a lot of issues, sometimes we can do a procedure in the office where we get rid of them. But a lot of times it gets better with just kind of treating constipation or treating diarrhea or kind of stopping the straining.
So it's something that can just be managed.
Yeah, so we talk about conservative management is our first step, and to some of the things he spoke about. But one thing to add to that is fiber. We can't underestimate the importance of fiber with treating hemorrhoids. And in this country, we just tend not to eat a lot of foods with enough fiber in them. And so if you start counting the fiber content of your foods, you quickly realize that it's hard to get. We recommend 20 to 25 grams of fiber a day. And so unless you're really concentrating on getting high fiber foods, it can be pretty tough. So a lot of times we'll recommend fiber supplements to be taken along with a normal diet. And so a lot of times really fiber supplements by themselves are enough to treat this.
Well, what if someone has really gotten beyond that point?
Yeah, exactly. So we talked about conservative. So the next step, he referred to a procedure that we do. Historically, what was done was surgical hemorrhoidectomy, which can be pretty difficult and has a long recovery and it's fraught with complications. So in our office, we've been doing something for the last 8 or so years called hemorrhoid banding, which sounds really bad when you first start telling people about it, but it's actually very well tolerated, has very high success rates, just really painless. People can do it in the office. There's no prep, there's no sedation. It's just basically just like come in and see us for 10 minutes. It takes about 2 or 3 minutes to do the procedure, and very effective.
Good news.
Yes.
Because I'm a victim of one of those old school, the surgery. It was rough. Well, tell me though about anal fissures. What's the difference between?
I think it's important to talk about that along with hemorrhoids because they oftentimes get confused. But anal fissures are a little tear that occur in the anal canal, and it's very important for us to make sure that that's not what's going on because that's treated a little bit differently than hemorrhoids.
And it could be inflammation.
And that's usually associated with a whole lot of pain. Right. It's very, very painful with bowel movements. Whereas hemorrhoids, they can hurt, but they're normally not extreme pain with bowel movements. That's usually more
you
of a
would
fissure.
know the difference if you had the anal fissures.
Yeah, we would determine that during our exam.
Okay, great. So good to have the experts right here in the Golden Triangle. And did you know that the doctors at Gastroenterology Associates here in Columbus, Starkville, the Golden Triangle are board certified? Absolutely total professionals. You've got to visit their website as well. Check it out. It has a lot of good education on all of your digestive health issues.